Good day, I'm Choi Yek from Malaysia. Together with Dr. Chu Tan Sun from Vietnam, we will share about pediatric POCUS training in Malaysia and Vietnam. I have nothing to disclose. I work at Kuching, Sarawak, Malaysia. It is located on Borneo Island, as shown by the red arrow. I'm a pediatric intensivist at PICU Sarawak General Hospital, which has 10 beds and nearly 350 admissions per year. I'm blessed with 2 ultrasound machines that enlighten my life every day at work. I'm a product of Success Malaysia. Success is the Society of Critical and Emergency Sonography Malaysia, a professional organization in Malaysia dedicated to advancing the use of ultrasound in emergency and critical care medicine through education, training, and certification of healthcare professions. These are the founders of Success Malaysia: Dr. Adi Osman, Dr. Mahata, Dr. Sharidan, and Dr. Muhammad Fadri. I'm very honored to be coached by some of them. Success started back in 2006. Professor Luca Neri, past president and co-founder of WinFocus, conducted the first WinFocus provider certification in Malaysia. 2 years later, WinFocus Malaysia was established, which rebranded itself later to Success Malaysia in 2012. In 2014, Success was entrusted to hold the 10th WinFocus Congress in Malaysia. Following year, Success established fellowship training in POCUS and integrated POCUS into the syllabus of local medical school. The courses that conducted by Success from all levels of healthcare provider, which include doctors from various specialties, pediatric, primary care physician, paramedics, and WinFocus focused cardiac ultrasound. Success Provider Certification Assessment is for the candidate who have successfully gone through the named course earlier. The participants need to collect their work in logbooks and go through MCQ, ultrasound video clips, and hands-on examination before awarded a provider certification to certify themselves as a trained POCUS provider. As a POCUS trainer, I felt that students find tips and tricks to get the right image useful during training. With the right image, good interpretation of the image will follow. The simple step-by-step approach for getting different views in echocardiogram will remove the main obstacle in echocardiogram study. Seeing is believing. Bedside teaching and clinical correlation with ultrasound finding will impress students and increase their interest to learn more. They can see real-time ultrasound image that can change with their clinical intervention. That is what point-of-care ultrasound all about. Cost in training is a big issue for developing countries like Malaysia and Vietnam, but practice makes perfect. Line phantom is expensive and costs about $468. Success Malaysia has created an innovative way to overcome the problem, which costs only $1. The simple and quick way to create the line phantom using a small piece of the chicken breast, a long balloon, and kitchen cling film as demonstrated in the video. It can be done in minutes and create an image with high fidelity. The image from the phantom is comparable to the commercial one, as you can observe in the video showing different techniques of insertion. I also record my POCUS teaching in my YouTube channel for my students to revise again. Next, I would like to share with you how I assist pediatric POCUS training in Vietnam and the creation of VISUAL, which stands for Vietnam Intensive Care Service Ultrasound Lesson. In 2018, I was contacted by Professor Julina, the current president-elect of WinFocus. She linked me to Dr. Du Hong An, an adult intensivist from Vietnam, who completed her fellowship training in POCUS at Malaysia. Through this, I was honored to assist the pediatric POCUS training in Ho Chi Minh City and then Hanoi and Vietnam. Dr. An is a pioneer POCUS educator in Vietnam. Her great effort from 2018 has made the POCUS education a success throughout Vietnam. The POCUS training in Vietnam is done using hybrid technique with physical and online learning method. The training has 5 important components, which are a 2-day physical workshop, POCUS journal clubs, case discussion through WhatsApp, logbook, and finally provider certification exam, which mimics Success Malaysia training system. The first 2-day physical workshop was carried out at Children's Hospital No. 2 at Ho Chi Minh City in 2019. During the 2-day course, unfortunately, we had only 3 POCUS trained facilitators and assisted by 1 product specialist from the ultrasound industry. There were more than 30 enthusiastic participants, although we planned for only 30. There was a significant language barrier, and my lesson needed to be translated into Vietnamese. I also had 1 personal translator who translated the whole event for me. This made me realize that the importance of creating the local training team. There was also no professional model. The model were participants who sacrificed themselves during the training, and more importantly, the patient at PICU be the best model during the course because of their pathological finding could be shown real time. Apart from that, online platform has served as an important learning portal. The journal club was started after the physical workshop, coached by Dr. N physically and myself who joined in online. Presentation was done by students, followed by a case-back video quiz by myself. The hands-on practice uses 3 ultrasound machines and students as model. 10 topics were discussed every 2 to 3 weeks at weekend over the period of 5 months. We did an online study for the journal club, which showed half of the students satisfied the journal club, while the other half felt that they did not learn as much as expected. What they enjoyed most was a video quiz. What they did not like was a student teaching, with sometimes which may be too long. The student also felt that the hands-on session was not helpful because of the limited numbers of ultrasound machines, big number of students, and no proper model. This clearly showed that the short lecture, appropriate machine to student ratio, and appropriate models is important in POCUS teaching. We are happy that we have sparked their interest in using POCUS in their daily clinical practice, despite our limitation. As lacking of on-site POCUS tutor, the discussion of the cases and interpretation of image was done using WhatsApp. Dr. N and myself have become POCUS tutor without border. This requires a lot of commitment. In 2020, the COVID hit hard. It affected the training in Hanoi, which had just begun in May 2020. Thankfully, the online training managed to continue for 1 year, then stopped silently due to overwhelming COVID caseload. The training restarted immediately after the COVID cases showed reducing trend in June 2020. Since then, the hybrid course and assessment were conducted in 2 months, with students collecting their cases in their logbook. Online case presentations by students with external examiner from Malaysia and Singapore, MCQ, ultrasound video image interpretation, and physical hands-on examination at Hanoi. Finally, the physical hands-on examination was held at Hanoi in August 2020 by Dr. Jin On and Dr. Takaaki, pediatric emergency physician from KK Women and Children Hospital, Singapore, Dr. Lien and Dr. N from Vietnam, and myself. Following that, Dr. Takaaki wrote a paper entitled Implementation and Assessment of a Hybrid Training Course on Point-of-Care Pediatric Ultrasound in Vietnam during the COVID-19 pandemic, which published in last September. The study showed that the training method increased the self-efficacy level of students significantly in pediatric POCUS skill. Creating a new topics and way of teaching is challenging. It requires a strong leader with a vision, especially in Vietnam. Dr. Pan Hu Phuc is the senior pediatric intensivist at Vietnam National Children's Hospital, whom had encouraged and built out the bridge of learning for the students at his hospital. Besides that, it also required tireless and committed pioneers to steer the process. Dr. N and Dr. Lien had contributed tremendously in this process. Not to forget the enthusiastic students and the selfless support from Success Malaysia, which made the dream of creating the Vietnam POCUS training group come true. The students had gone through the accreditation process by the Success Malaysia last September. We are very happy to see the transformation from concept into reality. The visual group now is on their own, starting to deliver the courses in their own language, in their own style. I will now invite Dr. Chu Tan Sun, a pediatric intensivist from Vietnam National Children's Hospital, who has gone through the training process, to share his view about the whole process.
Hello, I am Dr. Chu Thanh Sơn. I'm a pediatric intensivist at Vietnam National Children's Hospital, VNCH. PNCH is tertiary referral hospital for the northern Vietnam that provide all subspecialty for the child health, including complex pediatric cardiac surgery. It has 28 bed PICU and 48 bed for pediatric high dependency. Annual admission to PICU is 2,500 cases. 220 patients underwent CRRT, TPE, and hemoperfusion. 30 patients receive ECMO per year. We all recognize the critical role that POCUS play in the daily care of severely ill patients. However, in Vietnam, the use of POCUS is limited. There are insufficient opportunities for POCUS education due to the lack of educational resources and local teaching faculty. Dr. Phuc is deputy head of PICU. He was determined to implement POCUS in our department. He invited Dr. Hồng Anh, Dr. Lim, who are the faculty member at University of Medicine and Pharmacology in Ho Chi Minh City. Dr. Hồng Anh was a fellow in emergency and critical care ultrasound in Malaysia. Dr. Lim was one of her top students. They are considered pioneers in POCUS in Vietnam. With the support from Dr. Hồng Anh, we invited Dr. Kho, a POCUS expert from Malaysia, to teach us. As can be seen, the distance between Hanoi and Ho Chi Minh City were 1,100 kilometers, while the distance between Hanoi and Malaysia was 2,200 kilometers. The challenge we have to face, the first is geographical distance that I mentioned before. COVID-19 pandemic had disrupted our plan to organize the training course. A lot of activity has had to postpone or cancel. Like a resource such as equipment can be hinder effective trainer. Some topic or skill are complex, make them harder to learn, such as cardiac ultrasound and hemodynamic assessment. Balancing training with other responsibility or work, sometimes it can be a significant challenge for us. Maintaining interest and motivation throughout the training program sometimes can be difficult, especially for long and repetitive courses. Retaining and applying what we learn can be challenging, especially if there's no opportunity to practice or reinforce the knowledge and skill. Due to geographical distance, we have to acquire basic knowledge through online lecture via video conference. We also form a group where we can share our clip, ask the question, and receive recommendation on how to obtain better image. While online training platforms offer numerous advantages, they also come with challenges. Some skills, particularly those require hand-on practice, may not be effectively taught through online component alone. Therefore, we use a hybrid approach. We combine online learning with in-person hand-on training. Outstanding trainee will become a key trainee who can take on the role of the peer educator, have to explain concept or assist others in the course. Engaging leadership involves active participation, financial support, and a commitment to develop POCUS in our hospital. We went through accreditation assessment in September this year from Society of Critical and Emergency Sonography, widely recognized as Success Malaysia. We established a team which we named ourselves as Visual, Vietnam Intensive Care Service Ultrasound Lesson with Dr. Core idea. We started to provide the POCUS teaching to the doctor in Vietnam in our own language with our own material. Our next plan, we will enhance proficiency in POCUS skill and continually update knowledge. We will recruit qualified faculty members who meet the eligibility criteria for teaching POCUS. We will extend POCUS training program to residents and physicians in other provinces, and we will foster collaboration with international experts and POCUS organizations.
To sum up, based on our experience at Malaysia and Vietnam, we feel that teaching POCUS needs a structured program. It is more than a 2-day course, but include other aspects like ongoing coaching and assessment. Physical course need a short lecture, appropriate machine to student ratio and model. Teaching using case study with ultrasound image generate more interest among students, which need to be emphasized. Creativity need to apply to overcome any deficiency, like our chicken phantom and online tutor without border. Local regulatory body or POCUS society like Success Malaysia or Visual Vietnam need to be established to ensure quality teaching and conduct appropriate certification. With that, I thank you for your attention.